My name is Lorette Mushimimana. I'm a mother of two, and my position in Growing Health, I'm program coordinator. So the program have started in May, the 1st of May 2015. We started feeding 30 patients from pediatric wards. They were including the mothers of babies, premature babies that were in the neonatology ward. And before the program started, those babies mostly were dying because the patients that we started feeding were the patients that were from very far, as this is a reference hospital. The patients were coming from very far distances, from very poor families, and they had no access to food whatsoever. So the mothers were delivering premature babies, and the nurses could be requesting for them to press the breast milk every 2 hours to take the children in the tube, but they had no breast milk. So as a result, those babies mostly were dying, or they were taking months and months without gaining weight, and they were taking more than 3 months in the hospital. We started feeding them with the 2 meals per day, giving them a very nutritious porridge in the morning. So after having that porridge, they could get the milk around 10, and then the impact was so positive that the babies started to gain weight. You know, it was so exciting to see how the mothers who had no breast milk before were now starting to have breast milk, and the babies were, you know, being discharged even after 1 month or even after 3 weeks. And then the children in pediatric wards, the effect of medicine they were receiving started to be more positive. Where currently we are getting our income from the donations, from private donations, from HRH staff. But apart from that, we are also having a farm, a pig farm, all in with the intention of wanting to get some income to support the program. Because we are only living on donations, but we are still longing and wanting to get more, to do more income generating activities to support the program so that it may be sustainable.
So there you. My name is Andre Manishimwe. I'm the training, monitoring, and evaluation manager in Growing Health. So the main goal here is to make sure that people can have nutritious food. Of course, a balanced diet. So what we're doing is to integrate food security, nutrition, and human health. And as you can see, we have the plots and we're growing different crops. So among them we have vegetables, but also we have cereals, and we are harvesting those crops, and those are supporting our program. Of course, everything we need to have a balanced diet is not, you know, cultivated here. But what I can tell you is that we can go and buy some crops, you know, and some food in the market. But what we have here also is very interesting, because those patients, those beneficiaries also come in our plots, then they can learn the best agricultural practices, and we can train them. Then when they are good, they go back to their households, then they can even do the same practice, which is really very interesting. So it is not only feeding people, but also training them on good agricultural technique. Yeah, we have many goals. One of them is what I mentioned, but there's another one to do the follow-up of the people who have been here. Then we'll go to the grassroots level, we'll go to their households, then we can see how they're implementing what we taught them while they were in the hospital. So that's another goal. And of course, we will do an impact evaluation after 3 years to see the impact, you know, which is measurable, which is smart of this program. And with that, we'll be able to write some books, for example. Yeah, we can write a book We can even share, the results with other people.
I am Samuel Byiringiro. I am a nurse, and I am also helping in Kuzamura Ubuzima program. Every day when we are going to feed the patients, we give talk about nutrition education to our beneficiaries. This is because we know that they will not stay here for long, and when they go back home, they will need to make the complete diet back in their homes. So we don't want to give them a complete diet just here, then once they go back for again in malnutrition. We want them to keep practicing and making complete diet back in their homes. Growing Health is really helping me grow my career, because when I'm providing food to the clients, when I am educating them about nutrition, this is part of my career, and this is something that will really help me in the future, because these skills that I get while I'm teaching them, this patient that this education that I give to them, I keep mastering it, and I will keep doing it even elsewhere where I will be working as a nurse.
nabimenye igihe naje ahangaha bintunguye nza bintunguye nta mafaranga mfite ntacyo kurya mbega naje nk'umuntu nyine bitunguye noneho mpageze numva yuko hano hari ahantu bajya batanga ibyo kurya, ariko kuko nari ntarajya kuri lisiti nkajya nza ngafunguza bigeze ubwo banyandika njya kuri lisiti, ariko kuko banshyize kuri lisiti bitangira mbona ari byiza, n'umwana wanjye ngenda mbona agenda agarura akajisho, kuko bantegekaga kumuha amata n'amagi, kandi amagi nta bushobozi nari mfite bwo kuba najya kuyagura buri munsi, ariko ngize amahirwe ririya gi mbona baduha ibiryo mbona bashyiraho n'igi, ariko iyo ariye biramfasha kuko rya jana nari kujya kugura iki aba yaribonye nabasha kungurira ikindi, rero nuko nanjye nabimye.
Innocent Uwineza bicamu kuri hano.
Well, growing health needs really more funds. We need to be more sustainable, because we want this program to grow. We take this as a pilot project, but we would be so happy if it spreads even in all the other hospitals in Rwanda. So we really need our program to be sustainable. We need funds, we need more donations, we need some more income generating activities so that we still may keep up the program.